person has a seizure, they're helpless.
7 weeks after transgender inmate Layleen Polanco died on Rikers Island, the medical examiner revealed her death was a result of her epilepsy, which caused a seizure. Polanco's family also just received a copy of her Rikers medical records. They shared them first with Pix 11.
The Department of Correction knew of Layleen's medical conditions, specifically knew that she had epilepsy.
David Shanies is the attorney for Layleen's family and her estate. He wants to know, given her medical history, why was Polanco held alone in a cell?
A doctor specifically authorized that Layleen be put in punitive segregation despite her epilepsy, and that is just unthinkable.
Shani says according to the medical records, Polanco had his seizure while on Rikers on April 30th. From May 15th to the 24th, she was hospitalized for treatment at Elmhurst Hospital. On May 30th, the doctor from the Correctional Health Services cleared Polanco to be placed in restrictive housing. She was in a cell by herself on June 7th when she had a fatal seizure.
Patients with seizures, they need to be monitored regularly.
Dr. Lippy Roy is the former chief of addiction medicine on Rikers Island.
Questions that I would have as a doctor, was she on the right medication, the right dosing, and she would probably need to be frequently monitored.
The Bronx District Attorney's Office is now looking into Polanco's death. Polanco was arrested on April 13th on a warrant for a drug possession case, but could not afford her $500 bail. She was placed in restrictive housing 8 days before her death. The Department of Correction told Pix 11 people in restrictive housing units have access to medical care 24 hours a day if they request to go to the clinic.